Okay. I'm Dr. Liz Phillips, and this is Romil Patel, and we're members of the team Bleed Freeze. Who here has had a nosebleed by raise of hand? Most of us have experienced a nosebleed. We are an early-stage medical device startup, and Bleed Freeze combines cooling, compression, and medication, the mainstays of treating a nosebleed that I know from being an ER doctor, into a single convenient device that can be used at home by mom or dad on their child, or by me in a busy emergency department. Nosebleeds are a very common problem. Up to 60% of individuals will experience a nosebleed in their lifetime, and there's more than 500,000 visits to the ER annually for nosebleeds in the US alone. This costs us more than $350 million in healthcare expenditures just in the United States. I came up with the idea of Nosebleed as an ER resident. People will come to me covered in blood, anxious, scared, looking to me for help, and I would then have to run all over my department to collect all the supplies I needed to treat them. I kept thinking there must be an easier solution, something to avoid making this a hassle at home and when I'm at work. So I gathered a great team around me, which included myself, Romil, who's an undergrad in biomedical engineering, and our two physician advisors, Dr. Neal Sikka and Hamid, Shokoohi, both attendings in the emergency department with years of experience in clinical practice and innovative medicine. We're hoping there might be an additional teammate sitting amongst you today. So you might ask me, how do you treat a nosebleed? Maybe your grandma told you to pinch your nose, put your head back, and apply an ice pack to your forehead, or was it the back of your neck? The correct way to actually treat a nosebleed is to apply constant, uninterrupted pressure to the soft sidewalls of your nose with your head slightly downward for a minimum of 15 minutes. This sounds simple, right? It's actually really challenging to do. Go ahead, everyone, pinch their nose. I'm going to see if you can last just to the end of my next slide. Most people put pressure on the wrong part of their nose, don't hold pressure long enough, and find this difficult to do because they're anxious and there's blood going everywhere. In addition to that, nosebleeds are most common in children ages 2 to 10 and older adults ages 60 to 80, the individuals least likely to handle this emergency well.
Nosebleeds cost more than just money. They cost time and opportunity. Imagine as a parent having to take your child into the car, driving through traffic, and then in the emergency room waiting up to 4 to 5 hours on end. This can be a very frustrating experience. On the flip side, as a hospital manager, I not only have to reduce cost, but also have to worry about improving efficiency and productivity amongst my staff. As we all know, time is money. Here is Dr. Shokoohi explaining the inefficiencies in the emergency room today with dealing with nosebleeds.
I'm Dr. Shokoohi. I'm one of the emergency physicians and dealing with the nosebleed almost every day. Every week we are seeing a lot of patients with the nosebleed. In the emergency room, I need to use all this equipment here. I need to actually put this long cotton that's filled with the water inside, keep it in for at least 48 hours, start them on antibiotic, follow up with the ENT. It's absolutely not fun. So how if we could prevent all these issues is to have a bleed freeze, have proper kind of compression, cool compression with a little bit of medication on the top of it, and do it at the right timing. At home, you could do it and prevent and not to just come to the emergency room. Or here, if I had that one really, instead of just asking him to hold it with the hand, you can have it hand-free, just apply it in here, wait in here, see him for 15, 20 minutes, and just after that discharge him home with no complication, with no antibiotic, with nothing else, and that is complete bleed freeze.
Bleed Freeze is an easy-to-use, simple device and very effective for treating nosebleeds. At its core, it is an innovative nasal clip that provides hands-free compression in adjustable sizes for children and adults. It works in 3 simple steps. First, the user applies a vasoconstrictive medication onto the nasal prongs. As they insert the nasal prongs into the nostrils and then fit over the medical device on the nose, then they simply slide over the cooling pack, which has an integrated timer to notify the patient when to check for bleeding after 15 to 20 minutes.
Our customers involve 3 large segments, the first of which are medical settings. There's over 14,000 urgent cares and ERs in the US alone. Sports medicine professionals in schools comprise our second tier, so there's 18,000 athletic trainers and 100,000 schools that have a school nurse that could benefit from this product. Finally, we have our everyday direct-to-consumer. Dr. Sikka, whose son gets a nosebleed every day in the winter months when the air is cold and dry, or the older individual that's on blood thinners worrying about bleeding. Over the past several months, we've conducted over 30 customer segment interviews that have validated a usefulness for our device in each of these areas. We talked to doctors, physicians, the nurses, techs, EMTs. They told us they thought this was a great idea because it was convenient, it reduced the amount of time staff spent with a patient, reduced that patient's length of stay, increased patient satisfaction, both of which are important hospital benchmarks that hospitals rely upon for their reimbursement. They suggested that we reach out through group purchasing organizations. For example, a doctor at GW could request for bleed freeze to be stocked by their nurse manager, and a similar model could be employed through group purchasing organizations nationwide. In Tier 2, we talked to trainers, coaches, specifically wrestling and basketball, who told us every day at practice a kid was getting elbowed and bleeding all over the place. They thought the device would be really helpful because it was hands-free, it was effective, it got that kid back into play, and they suggested that we reached out to trainers in particular, since they're the ones who would stock this device, and that we could reach them through conferences or professional organizations. Finally, we talked to the everyday mom and dad, the older adult on the blood thinners. They liked the device because it was comfortable, easy to use, and certainly something they could spend $20 on versus a $700 ER visit. They wanted to make sure it was something they could easily access through a CVS, local pharmacy, or order online.
The first aid industry is $3.75 billion. We've structured a marketing strategy as a channel leverage approach by first targeting hospitals and medical providers. We understand that they have large and renewable purchasing orders, which we can then spread our brand awareness through physicians and patients alike. And then we can roll into our Tier 2 and Tier 3 customer segmentations. Our ultimate goal is for bleed freeze to be in every medicine cabinet, glove compartment, and in every first aid kit. Bleed freeze has a few competitors. Our first is nasal cease. It's an FDA-approved nasal plug. However, customers believe it's not as effective in treating moderate to severe nosebleeds, and its active ingredients can also vary in effectiveness. Nosebleed is simply just an ice pack shaped to fit the nose. It does not provide any hands-free compression, no medication. It's $20 for just one, and is only available online. NoseAid is another FDA-approved hands-free clip. It only comes in one size. It's only available online, and shipping and handling can be very expensive. Bottom line is, Nosebleed is simply better. No other product combines compression, cooling, medication, all into one device. We provide our users with a hands-free and comfortable experience with treating a nosebleed. It has an integrated timer to make the patient more independent, to know when to take it off and to check for bleeding. And we recognize that we need to have different sizes for children and adults, and the opportunity is there to seize the hospital market setting first.
We have a few milestones that we need to meet in the first year. The first and foremost, we want to protect our intellectual property. We've already filed a provisional patent with the Office of Technology Transfer here at GW. We're hoping in the first year to build our prototype, find some additional funding so we can test it in the field. So by 2016, we're going through our FDA approval process. We recognize that this technology might be ripe for licensing opportunities. Our goal is to be manufacturing and rolling out to our Tier 1 customer segments in 2017, followed by Tier 2 and Tier 3. Here's Dr. Neal Sikka with some of our financial projections.
Hi, I'm Neal Sikka, and I'm part of the Bleed Freeze team. I'm going to tell you about how Bleed Freeze makes money through our financial projections. We believe the first year of Bleed Freeze will primarily be spent in product development in an FDA 510K clearance process. We estimate that will cost us about $35,000 to $50,000. From our product customer interviews, we plan to sell and package Bleed Freeze in units of 3, and the cost of each of those packages will be $20. Our manufacturing and shipping cost is $12. So the go-to-market strategy is to start with a Tier 1 marketplace, which is hospitals and urgent care centers. There are about 14,000 hospitals and urgent care centers in the United States. We estimate in the year 1 we can reach 1% market share, and by 2019 about 15% market share. In year 2 of business, we want to expand to our Tier 2 market, which is school nurses and trainers. There's about 118,000 of them. We again estimate a 1% at market entry, reaching 15% market share over about 3 years. In the third year of business, we want to expand to the Tier 3 market, which is retail pharmacies. If we can get a distribution deal with just one of the large retail pharmacy chains, we can have 25% market penetration.
Here are the pre-revenue models that Dr. Sikka mentioned earlier with the assumptions for our financial projections. At our 5-year benchmark, we estimate to have profitability within tens of millions of dollars with revenues in the $24 million range.
So you might ask, why bleed freeze, why now? Well, our team recognized that after the passage of the Affordable Care Act, the healthcare payment models changed. People are increasingly interested in the first aid industry because they're trying to avoid visits to the hospitals, and hospitals are constantly looking for ways to cut costs and resource utilization. Our team has the talent and the technology to take bleed-freeze to the top. We've already participated in the DC I-Corps in February this year and conducted customer interviews that validated usefulness in each of our customer segment tiers. We're hoping this summer to go to the NSF I-Corps and win this competition, which will give us the capital and the momentum to take bleed-freeze to the top.
With the first place prize money of $35,000, we can continue developing and designing our prototypes, as well as beginning our FDA approval process for a Class 2 medical device. We recognize the exposure that we're getting with the business plan competition and hope that someone today's audience can join our team.
So in summary, nosebleeds are a big problem. They cause over 500,000 visits to the ER in just the US alone. They're costing our healthcare system $350 million. And the solution is bleed-freeze, the easy-to-use, convenient device that combines compression, cooling, and medication that can be utilized at home by a parent with no medical knowledge or by me, a physician in a busy ER department, for only $20. None of our competitors combine all the elements that are included in our device. And we recognize the opportunity to seize the market by utilizing our contacts with the hospitals and using our Tier 1 market momentum to carry us to eventually the retail market. We think that we'll be able to make over $24 million by the end of 5 years and put $10 million in our pocket. Our team is the dedicated, driven, passionate, and knowledgeable individuals that want to make bleed-freeze a household name for nosebleed rescue. Thank you for your time.
Question. I'm wondering, the question is about your channel strategy. If I'm a Tier 1 channel, I guess I'm not sure if you're going direct or not to these hospitals, but why would a Tier 2 or 3 provider, well, let me put it this way. If I were Tier 1, why would I allow a Tier 2 channel to occur without me locking it up? In other words, I'm the Tier 1 channel guy. I want to own you guys. I don't want you to be going through other markets. How do you prevent that?
So a lot of hospitals, including like our larger hospital centers like MedStar, they have not just hospital settings, but urgent cares and partnerships with like local schools and clinics. So I actually don't think that they would be as possessive of the market because they realize that it's something that they could actually pass on and provide to their patient or customer base in environments outside of the hospital. They just know as a Tier 1 guy, that's where you're going to get your sustainable, renewable contracts that are large and guaranteeing a renewal stream. And then by going to Tier 2, you're kind of opening up your market, and that those still might be people that are going to feed back into you eventually. So I think that it's not necessarily a conflicting interest.
I had a question about the bill of materials, the device.
Sure.
It looks like it's more complicated to use than any of the 3 incumbents, and it looks like it costs more to make. That'd be my guess. And your argument would be that because it does the 3 different kinds of cure at one time, that it's more effective. How did your customer interviews assure you that that was of value to your customers? Why would they do something that's more complicated and more expensive in order to, what benefit would they get out of it?
Sure. The device is actually going to be pretty simple. I mean, the way we described it might be.
Cooling bag and
So all it really is that we're a little limited in the detail we can show you because of our IP. But so you can understand there's medicine that you'd be able to just slip onto prongs, and then you're basically just applying a clip and pulling an ice pack over it. So it has maybe an additional step than just the clip, but it would be kind of explicitly signed out. And I think that people would be willing to do that because it is showing them the proper way to treat the nosebleed. It would take care of it the first time. And the main concern with our customer interviews is they were trying to avoid going to the ER. They would tell us that their kid was getting a nosebleed like every night when the heater was on, and they would call their doctor, and the doctor would finally say, well, I don't know what to do, go to the ER. And so I think if they knew the proper steps, that they'd be willing to invest that $20 instead of having to rely on, medical referral or an actual trip to the ER.
The costs, as you mentioned, the costs that we use are costs for our prototype manufacturing device. We know as we scale up, we can dramatically reduce that cost and increase profitability.
So what do you figure that it's going to cost at scale?
As an early stage startup, unfortunately, we haven't gone into detail about that.
I think it could go half of what we are, at least half, if we are able to scale up.
I'm sorry, I don't mean to interrupt, but I just had a second question related. What sort of performance claims will you be able to make when you go through this, the certification? I mean, is it faster, better, cheaper, quicker? I mean, clearly it's not the cheaper part, but you'll be able to say something about the performance of this versus the existing state-of-the-art.
While we go through the FDA approval process, there's a lot of bench testing that we need to include in our application. And before we even go into clinical trial testing, which can cost a lot of money, we can do simple voice of customer trials, which we can have small clusters of patients that we can use. We can do our own benchmark testing, like timing, how long does it effectively take to reduce the nosebleed. We do not, no.
Yeah, so I have a question. With regard to your tier 1 customers, the medical institutions, what types of incentives have you created so that they can embrace your product? Because that's going to be a significant barrier or challenge to penetrate market.
So right now, as a physician, the options I have to manage nosebleeds is I can tape together 2 tongue depressors, and so that the person doesn't have to hold their nose, and that would be the cheapest option the hospital has. Or if I really feel like I can't deal with it, then I'll put in a rhino rocket, or the thing Dr. Shokoohi was showing you. That costs $50 and requires a medical intervention in 48 hours. That's much more expensive for the hospital to deal with than if I actually had a nose clip that I could put on that would save my physician time, get the patient out the door, and solve my problem. So I think the hospitals would be attracted to the length of stay that could be related to the savings. And it's also a low cost. There's a certain threshold, like I said, as a GWInnovate doctor, I could ask, I want to try this device, can you stock it? And they're going to have a price cutoff, which is in the hundreds of dollars. If it doesn't cost more than that, the hospital will be okay, if you want to try that, we can try it. And you can kind of use that to roll up, and if it's successful, then the hospital will renew that purchase. But since it's lower than that threshold, it's pretty easy. There's a low barrier to get it into the hospital because it's $20.
Right. So you want to highlight that. You want to highlight the incentives, because I have some experience with the medical startups, and quite often the establishment will not even entertain the product if they don't see an incentive in their medical world on a day-to-day basis.
Why don't the hospitals use those incumbent products today?
Yeah, I thought it was interesting because when I first started this, I didn't even know that these existed until I did the research to figure out what was on the landscape. I think it's that the products don't really look like they're that effective. From everything that I read, the NoseAid one, which is just a clip, it falls off. It's not really useful for kids at all because it's way too big. It comes into the vision of the eyes, and so I think it just really hasn't picked up momentum. A lot of those also are just going direct to consumer. They're not utilizing the customer tiers, which is why we want to establish kind of a foundation among physicians that will give us the reputation that this is the way you should treat your nosebleed. Other questions?
Have you identified other tier 1 clients aside from medical institutions that perhaps may be quicker paths to financial, to generating income?
I think the kind of lower, less critical financial settings, such like nursing homes, urgent care centers, a lot of them can be private or subsidiaries, and they'll have more independence over what they can buy versus the larger hospital systems, and they still would be really interested. Specifically nursing homes where they have older adults is a very common problem in the 60 to 80 year age group that I mentioned, and those are the ones that are on blood thinners, and the last thing a nursing home wants to do is have to pack up one of their residents and ship them off to the hospital for something that they could take care of in-house.
Urgent care centers are also increasing on average 50 to 100 new urgent care centers in the U.S., give or take merging and all that. But so it's a market that's keep increasing.
The source of the nosebleed doesn't matter. I mean, if I'm allergic, I'm heat, I get bumped in my nose, nosebleed's a nosebleed.
So 90% of nosebleeds are called anterior nosebleeds. There's a small subset that are a posterior nosebleed that come from a large artery near the back. Those are life-threatening emergencies. Those people will have blood just flowing out of them. And there are specific medical devices that a physician has to insert to control those. But the vast majority of nosebleed that all come from your castle plexus, which are all the small veins up here, which is why you have to apply pressure here. And that's why a lot of people aren't successful at home, because they don't really understand that and they don't have the proper information and resources to control it well at home. But whether it's like from allergy, for most of the time in kids, it's because they're like sticking their hand up their nose at night when you don't see them. But allergies, sports, whatever it is, it's all treated the same way when it's an anterior bleed.
Thank you, guys.
Yeah.